this is Pat McDonald, your host for Vote for Vermont, where our tagline is listening beyond the sound bites. Today I am absolutely honored to welcome Al Gobeille, who's the Secretary of Human Services. Al, welcome to the show.
Thank you.
Joining us, of course, is Ben Kinsley, my co-host.
Thank you for being here.
Ben is the Executive Director for Campaign for Vermont. So welcome. This
Well,
is your first time on the show.
It is.
This is great. We'll have you back. We usually ask our guests to talk a little bit about their background, and we'll get to the why you took this job you've got a little later, but just a little bit about your background. And
Sure. So I'm a Rhode Islander. And
Really?
I came to Vermont to go to Norwich University a
good
long
school.
time ago now. And so I came up here, I went to school for 4 years, spent a little bit of time in the United States Army. While I was here, I met my wife. And so we got married while I was in the Army, and we moved back to Vermont.
Nice.
So that's
Ben's
sort of
a
what got me
graduate
here.
of Norwich, are
I
you
am.
not?
I'm a Norwich grad also.
Yeah.
Yeah. It's a great
Great.
school.
And so what have you done in Vermont? I've eaten at a few of your places.
Yeah.
So,
So I'm a restaurant owner.
Yeah.
My wife and I own a couple of restaurants now in Burlington. We had a third and a cruise business, but we've sold those. But we've been busy for over 20 years running restaurants.
that's great.
Yeah.
Great. And then I've got to ask you, so then somebody called you and asked you, for heaven's sakes, to be the head of the Green Mountain Care Board.
So
There's a big fat why came into my head.
well, so what's interesting is that happened later. So originally, when Act 48 was passed, it was created with a 5-member board. And if you remember, and I know you do, there was a big debate in the business community about
yeah.
what was called single-payer health care.
Yep.
And so I was on the board of the chamber, and I was on the select board in Shelburne, and I said, I kind of want to be a part of that conversation. And so I threw my name in to be a part-time board member and got on the board. I had no idea how much it would change my life, but I also had no idea how big of an issue it was going to be. And it still is. Meaning I knew the size of the issue and the complexity, but I didn't know how many years I'd be doing it and sort of its impact on me.
Right.
So that's all been good.
I have to tell you, and I pay attention a lot to these things, and I told you I watched the Green Mountain Care Board on cable, but I cannot explain it. And I've heard the explanations, I don't know, from you. Susan Grakowski is a friend of mine, and
Sure.
she can explain it, and it's hard to grasp, I must tell you.
Yeah, and I think what's hard is the current system is 20% of our economy. So it's so big that no person in 5 minutes can explain it to anybody.
Right.
Because of the size. And then the second piece is it's so important to people. It's our health care. So, that's what makes it so emotional.
Right. So I think we've got some questions about the Green Mountain Care Board.
Yeah, well, because you led the Green Mountain Care Board through the transition to Vermont Health Connect. That was a difficult transition. Obviously, it's complicated by federal legislation and a whole bunch of things. How do you feel like that process was from a leadership standpoint, and kind of what you were handed, and then where's that process today, or when you left?
Yeah, so Act 48, which created the Green Mountain Care Board, was not the Affordable Care Act. So that Affordable Care Act was a federal law that everyone is now familiar with as Obamacare. And so, while we were doing the work of Act 48, we basically had to implement the Affordable Care Act. Our state did. The board played what I would say is sort of a minor role in implementing the Affordable Care Act. Most of it was done by the Shumlin administration. But we certainly, got to see firsthand how difficult it was to implement. And so, I would say that, history will tell anyone that it didn't go well at first in Vermont or nationally. I think it took years for the computer system to really work as intended. And here we sit now with it still being at the fore of the national debate on whether or not we should have it or whether or not we should alter it. And I don't think those questions get answered easily.
There's no immediate answers anyway.
I don't think there are. I think you're seeing on the national stage just how tough this debate is over what is the right thing for health policy in America.
So do you think ACA is going to stand as it is? Do you think it's going to be modified? How do you think that might impact Vermont? I mean, those are big questions everyone's asking right now, but do you have any more insight than,
Well, I mean, I'm a spectator like everybody. I'm not, certainly not in the inner circles in Washington, but I think a really important thing happened during the Senate conversation. I think that the nation's governors really took a leadership position and sent the message to the Senate that a lot of the things that they were contemplating would be really bad for basically the states that the senators lived in. And that's where Senator McCain basically made his vote. And when he voted, he said, "I'm giving my vote to my governor." And I don't recall a time when governors have played such a pivotal role in a major piece of legislation. There's probably others, I just don't remember them. But it was a pretty important moment for the United States. And I say that because it makes me think that that whatever happens next, it's going to have to be done listening to all the voices and inclusive of governor input. And I'm hopeful that it will change over time. It needs to change. It needs to be fixed and repaired. But to just go back to, say, 2007 isn't really an option if you really study the issue.
Yeah, it seems like there's so much momentum going down this road, and I think that's partially what some of the governors saw, as well as things like the pre-existing conditions is something that is so popular across
Right.
the country that a lot of governors, I think, recognize that as a necessary piece of our healthcare fabric.
And there's other pieces, but that's a great example of something that people with pre-existing conditions would have told you long before the Affordable Care Act
Right.
how unfair and unjust our healthcare insurance world was and why it needed some government intervention. And so, that's a great example of something that should stay. There's other things that need to be improved upon, but again, I think it would be unwise for us to just try to go back to, say, 2007.
Just hit the reset button.
I think that time has passed.
And I think it would also create potentially a lot of chaos in our healthcare, which is, we've had enough chaos.
Right. I mean, the point I made a couple months ago is that the Affordable Care Act took about 4 years to implement for good reason. Whether you agree with it or disagree with it, it took a long time to implement. Not because the computer didn't work. I mean the changes in federal and state law to make it actually happen. It would take as equally as long of a time period to unwind it, because for example, we're setting rates on insurance for next calendar year. That's already happening. You can't just say, hey, as of January, let's go back to 2007. That would not would not be good for consumers.
Yeah.
So can I just say, when you left, can you explain where it is right now, where we're at in the whole process? If there's a snapshot of it, was when you walked out to go to AHS, what was there?
Yeah, so the governor after the election asked me if I wanted to do another big job, and I of course said yes.
Yeah.
And so at that point I had to leave the Vermont Care Board, and that was a tough decision because I cared about the people that worked there and my colleagues, and it's just a great group of folks.
Right.
And so I feel like they're in good shape to do what their charge is in statute. Basically, they're the regulators of our healthcare system. So they regulate hospital budgets and capital planning. We call it certificate of need. They regulate the insurance rate setting that we hear about so often, and a few other things that in the system. But they also have a really important role in innovation, which is the question of, is there any way that we can change the healthcare system that would make it better for us? And basically, if you divide the healthcare system up into 3 buckets, the first bucket is how you collect the money.
Mm-hmm.
And we had a long debate in our state over how we collect the money. That's sort of Medicare, Medicaid, commercial insurance.
Right.
If you put it all into one thing, it's called single payer. But that's how you collect the money. The next bucket is how you pay for goods and services in healthcare. Okay, that is independent of how you collect the money.
Mm-hmm.
Okay, so what the Vermont Care Board has been working on is how you pay for goods and services in healthcare. because how you deliver those services really matters to people. And so I believe the fight over how we collect the money, is sort of a misdirection. The real issues in healthcare are how we pay for and then how we deliver those services.
As cheap as possible and as good as possible.
Well, you want access,
Right.
you want high quality, but you also want coordination. You want your primary care doc talking with any specialist that you're going to
Right.
and making sure that everyone knows what meds you're on so that you don't get sick just because of the amount of meds you're on.
Right.
And so
good.
it's that type of coordination when you pay for and deliver care in a more meaningful way, and that's what the board was doing
That's great.
while I was there, and that's what they're still working on. And I'll also say that there's tremendous bipartisan support nationally, which there isn't bipartisan support nationally for much, for working on the two
Right,
buckets.
Right.
There's no support for how we collect the money, and that's the whole fight over Obamacare.
Yep.
But the other two buckets, there's a lot of support to try to innovate in that space so that people get better care.
That's great. So is
Yeah.
Kevin Mullen calling you every day?
I've talked to him quite a few times. He's
He's
doing.
the new chair of the
Yes.
Green Mountain Care
he's,
Board.
He's doing great.
Yeah, I bet.
doing
Well,
great.
he's got a lot of background in that in the legislature.
Yeah,
So.
yeah, I think.
Yeah.
So the innovation in that second bucket is that's really a lot of the work around ACOs and putting together a statewide accountable care organization to rethink the way that we reimburse for goods and for services within the healthcare industry.
Right. Yeah. So an accountable care organization is just like any company. It's just like it could be like a restaurant, meaning like any business. It's a group of providers coming together. Obviously, it's not a restaurant. In this case, it's a healthcare provider group. And what the ACO does is it allows diverse groups of providers to come together and change the way that they're paid. Currently, most healthcare in the United States is paid in what we call fee-for-service,
Right.
where for everything you do, you write it down now in a computer, and you get paid a fee for that service, which is sort of the way that you have your house worked on. If you bring somebody in to work on an appliance or to repair something, they come in and say, this is what it's going to take, and they itemize the bill and they charge you. But it's not the way you build a house. The way you build a house is you get a bid, and you say, how much to build this house? And they say, you want colonial, 2,800 square feet, mudroom, whatever.
Right.
Here's the bid. Well, healthcare's been delivered using fee-for-service payments now for 40, 50 years. Moving to more of a bid process, or what we call value-based payments, allows providers to work differently together, to be more concerned about the coordination of your care and not just the silo that they work in.
Right.
And so the optimistic point of view is that it'll allow for better care. If the coordination isn't there, then it won't get us any further than we are now.
So it basically incentivizes doctors to talk to each other outside of their specialty
Right.
about a certain patient.
Right.
Yeah.
Sounds good to me.
Yes.
Yeah, so I wanted people to get a sense of the scope of what you do. And
Sure.
just from a management perspective,
Yeah.
I mean, I was boggled in my mind how you went from a restaurant to Green Mountain Care, then to Human Services. Your management style, how do you make that transition for yourself and for the employees? I mean, how do you approach something like that?
So it's not easy.
No,
I
I
mean,
wouldn't
it's not
think
easy
so.
at all. I mean, obviously running restaurants is very different than the Green Mountain Care
Right.
Board, which is also very different than AHS. But there's some things that are the same.
Right.
And one thing I've always tried to do is surround myself with people that were smarter and better than me.
That you've got in that agency.
Well, I would say, some would say it's a low bar to get,
Oh,
to get
no,
smarter
I
than me.
don't think so.
But no, but the point is that, the folks that have come to work at the agency to be the key leaders of the agency are just fantastic. Some were there before I arrived, some we've brought in new. It's about how they all get along. Can we collaborate together?
Yeah.
So that's sort of the same game. The other thing is, that I talk a lot about is values. Like, how you run a restaurant and how you live your life and how you lead. And I talked a little bit about going to Norwich, but Norwich University teaches you to serve others and to put others before yourself. When you're a lieutenant in the Army, you're not supposed to be thinking about yourself. You're
Right.
supposed to be thinking about your soldiers. And so to the extent that we at AHS can worry about the clients that we serve and the people of Vermont and work together and have a little bit of fun, that's what we're trying to do.
That's right. Well, I told you before the show, because I knew a lot of the employees when I was in personnel. They're passionate about what they do.
They're very
and passionate about helping Vermonters. So,
Very much so.
yeah, it's great. And I think if they see, most employees, if they see a well-oiled management team working really well together and supporting each other, they have confidence in where you guys are going.
Yeah,
I think that's
would
good.
agree.
So what I was hoping to do before I was looking through your website, good website, by the way, if I took each of the departments, could we talk about what the
Sure.
key issues are? Because
Yeah. There's some
there's
stuff going on
something
here.
in every department.
There's more than one thing.
Well,
Absolutely.
I know, and these are just my ideas of what is hot in your agency. So if I've missed something, please just jump right in. But obviously, in your office, it's the federal cuts. That's probably the biggest thing that you're worried about from an office perspective.
Yeah. So the House bill, the House repeal and replace bill.
Right.
We took a look at that, said how much do we think this will impact Vermont, and our estimates got as high as $200 million to our Medicaid program.
Oh.
And so for the for folks that aren't aware how big Medicaid is,
Yeah.
it's about a $1.5 billion state and federal money together program, and that's a lot of money. But $200 million is a big hit.
Yes, it is.
And so we were glad that the governor was so strong in his leadership to oppose what was presented. Not easy for a Republican governor to do, but I think he did a really good job with that. The Senate bill actually changed some things that would have lessened that. And so, and when I say the Senate bill, that it never passed, but
Right.
so I sort of call it the Senate conversation.
Yeah, right, there you go.
Yeah, so they came up with a little bit better way for what it how it would have impacted Vermont, but still too much of a hit over time. More in the $50 million range.
Oh.
But still, that's a lot of money.
A lot of
And
hit.
so, so what goes on with the feds, they're our partner. Folks that have never been a part of the state healthcare game, Medicaid and other programs we run, don't realize that, it is a true partnership between us and the federal government in terms of, how we determine eligibility for programs, how we implement programs, how they're funded, and when they're a great partner, it makes everything
Right.
easy.
Right.
And when it's not a great relationship, it makes everything hard. And so we work every day to try to work with our federal partners, and we're hoping that as the debate picks up again, and it
Right,
will,
right.
that there's a continued learning about why this is so important.
What is the deadline for the federal budget? That's October, right?
October.
Isn't that
October.
yeah.
Right.
So-
when I was talking about the healthcare bill before with the numbers I gave you.
Oh.
Yeah, the federal budget, there's still a question over how that'll actually happen and occur. Yeah.
Because I know there's a potential meeting of the legislature sometime in October to deal with this,
Right.
right? In case,
There's a
in
week.
case it's bad, a week.
Right. A week saved, I believe,
Oh, really?
if needed.
Yeah,
Yeah.
oh, I think it's going to be, have you thinking of Plan Bs, just in the back of your
Well,
head? A little what if?
Yeah, so in the prior session, the legislature, to their credit, and the administration, to their
Right.
credit, worked together to put some money away.
Yes, I remember that.
To basically give us
Little
some
cushion.
opportunity, a little cushion if something happens. So
Right.
so I think we've tried to position ourselves, and the idea of the legislature giving itself time if it needed to come back was also part of that planning.
Yeah.
And I think that was a good
That's
idea
great.
too.
That's great, Benji.
So I think a lot of people, myself included, kind of looked at the healthcare bill that was in the Senate as a precursor to what might happen with the federal budget. Have you, your department, looked at that at all as to how the way that the healthcare bill is handled may impact the way that the budget is handled? Does it give you any hope in terms of what happened there, or?
So what's interesting is during the Senate conversation, they moved off of Medicaid. Medicaid sort of got taken off the table as something to really talk about.
Right.
And so I'm hopeful that that continues. And I described before about how the governors kind of came to the fore, and I think that was a strong message, as I've said, and I'm hopeful that that'll continue. As far as the impact of the rest of the federal budget, I think it really remains to be seen, because President Trump had talked about investments in infrastructure, which could be good for states if that actually ever makes it into a budget.
Right.
Yeah.
Well, the irony actually in that is, they're talking about infrastructure investments at the same time as cuts to the EPA,
Yeah.
which protects our waterways, which arguably is part of our infrastructure.
Which are definitely a part of our infrastructure.
Yes.
Yeah. So there has not been a clear message on all of this from Washington.
Right.
And so it's hard as a secretary or the member of an administration to really understand what's going on. I will tell you that in the last 6 months, every week, we've worked on scenarios based on what we've heard from people in Washington of what's going to happen here, what's going to happen there, and it's been very dramatic.
I'm sure it has been.
And what I say to people is, you were never supposed to know the name of your Medicaid director. You know what I mean? Like,
right.
Yet in every state they're on TV, once a week now.
Yeah.
And so I hope that we get to the point where we begin working on some of this stuff nationally to get the job done more than just the theater.
Yeah.
Because the theater's not helping at all.
Well, and I'm sure you must be in close communication with our representatives in Washington, with Senator Leahy, Senator Sanders,
yeah, sure.
Peter Welch, and
Right.
there's got to be, I'm sure, a constant flow of information.
We typically, it's definitely, and it's back and forth. And
Yeah.
so because we know our programs better than anybody, and we can try to figure out what the words mean and how they would impact things. And so they'll ask us questions, we'll send them information, they'll give us their take on it, and it's been very collaborative. But again, their staff, just like us, it's like,
Yeah.
they're
They're running all over the place.
yeah,
Exactly.
a lot of tail chasing.
So I guess the rest of us are just holding our breath, hoping that
Right,
things will work out.
that's right,
Yeah.
yeah.
So the next department which is one close to my heart, is Department of Children and Families. I'm very involved with Prevent Child Abuse Vermont. And I was gonna,
Best logo in the business, right?
Yes, it is, actually. Thank you for that. I'll pass that along. You came in after the Laura Sobel tragedy, and your staff, the people at Prevent Child Abuse who work really closely, they worked with Laura, they knew her.
Yeah.
How did you deal with that? It must have been very difficult for them.
So, it's still.
You came in right
I
after,
can't-
pretty much, right?
Yeah,
bit?
a little bit after. I'd give Ken Schatz and his team just
Yeah,
a ton
Ken's
of credit.
wonderful.
Just a ton of credit for, just the way how do you handle something
Right,
like that?
right.
It's really tough. And, the thing that I want to work on and the thing that concerns me is the security and safety of the staff
Right.
that we have now. And, it's a tough conversation.
I give
but
them
that
a
is,
lot of credit for just
Oh.
keep going to work, and because, I don't want to get off, we don't have much time. Center Vermont Home Health and Hospice, I was on their board, and we did some tours in people's homes.
Mhm.
And that's where, like your staff, they go in by themselves, and some of these homes are a little challenging. I'm being kind.
Yeah.
Some of them, I walked out going, God bless you. I don't know if I could do that.
I've gone and met and spent time with our staff around the state, and I was in the Army, and there's some tough folks in the Army. There's some
tough.
there's some folks that work at DCF that
Yeah.
if you saw in the grocery store, they're a 5'2" woman named Kim down in Springfield, for example. She's as tough as any Army
Well,
Ranger I've ever met.
think
The
but
stuff she does daily.
But they're tough and compassionate
they-
too, because
they are.
they've got to be
they're,
to do that
they're
job.
tough in that they work with, you want to talk about tough subjects,
Oh, you can't.
it's
children?
it's tough,
Yeah.
but they're doing the work of angels, and I just can't give them enough
Yeah,
credit.
That's great.
Yeah.
I don't think they get nearly enough recognition. And from Prevent Child Abuse Vermont, we've been watching the numbers go up of abuse because of the opiate issue,
Yeah.
and you've walked right into that.
Yeah, so Ken will say, and I'm only quoting him, that we've seen a 40% increase in the last 3 years in
Right.
in kids
Yeah.
that yeah, it's the opioid. You said, let's go through all the different departments, but what I think of are the things that sort of go through all the departments, and the
Yes.
opioid crisis is one of those.
Yep.
I mean, it is just, it has had an impact in every corner of our state and in
Yep.
everything that AHS does.
I bet.
And it is just, obviously it's a problem that we have not solved yet.
Is there, I think there's a group that's looking at this, isn't there?
Yeah.
And I don't know if the governor put somebody in charge of opiate czar, if
Yeah.
that's the title.
So Jolinda LeClaire.
Oh, of course, Jolinda,
Yeah.
you've got to get her on the show.
Yeah, you
I
should.
love Jolinda.
Oh, I describe her as somebody with 3 jet engines.
Oh,
on
I
her
know,
back.
she makes
Yeah.
me look like I'm falling
Yeah,
asleep and
so-
just woken up
Oh,
fuzzy. Yeah,
she's
she's crazy.
So
Nice crazy.
Yeah, so the governor, through executive order, created the Opioid Coordination Council, and we've met probably a half dozen or more times met for the afternoon
Yeah,
to try to bring to the council is made up of folks from across the spectrum of principals to law enforcement to
Right.
judges to business owners. It's a good cross section of treatment and mental health folks, and it brought together all these folks to say, can you by October make recommendations to improve our response to this crisis? And so we've been working really hard ever since the governor told us to get to work on this,
yeah, right.
to figure out what, to Governor Shumlin's credit, he did a lot.
He did.
And
Well,
so,
I was very confused, I think, when he took the whole
Yeah.
State of the State message, a couple of years ago,
Yeah.
and just talked about this, and I thought, what is he doing? Until as things started to come up about how serious this is, I said that was a smart thing for him to do to get us all
And
to
a
pay
bold
attention.
thing also,
Yeah,
I think, to
absolutely.
raise it, clearly take it to a national stage,
Yeah.
which he did, and put the state of Vermont out there in such a way as
Yeah,
to
'cause-
say, we're dealing with this and we're going to be open about it.
Yeah.
yeah,
I was very impressed afterwards. I wasn't when he was talking, because I'm like, what, hello? But I understood how important it was afterwards.
yeah, and I think that, the two of them have done a very good job of one person carrying, the issue as far as it could be carried, and now Governor Scott has come in and said, not good enough, team.
Right.
Let's, we've got to do even better. And so, we opened an emergency hub up in St. Albans because we're trying to get the wait list down to 0. So that was a big, complicated step, trying to open basically a methadone clinic.
Right.
And Northwestern Medical Center stepped up and said, you can open it up in our space, we'll help you do it. So everybody's trying, but the Opioid Council, to get back to that, everyone is working really hard to say, what can we do differently on top of what's already been done to try to fight this crisis? And
Yeah.
so I think that's really good work.
Well, I think even Washington's figured out this is a national crisis. It's not just a crisis here.
Yeah, the drug czar from
Yeah,
the White House
right,
came.
Right.
And,
Oh, did he?
Oh, yeah.
Oh, neat.
Richard Baum is his name, and he spent the whole day. Actually, he spent a little more than a day and a half here, and he took a look at what we're doing with our hub and spoke program, and he basically spent a whole morning with myself and our whole team and folks that do that work, and left saying that we basically have the model for the country.
Wow.
And
good for us.
and so we're trying to work with them on how we can make our program better, but also inform them. As I
Right.
said earlier, they're our partners
Yeah.
in how we do it and how it can be done elsewhere. But again, he was very complimentary to what Vermont's doing in response to the
Because the
crisis.
stories you hear about the kids, it's just heart-wrenching. It's
Oh.
just, and the numbers, as you said, I didn't realize it was 40%. That's ridiculous.
Well, and also, I try not to use big words, but I use the word ubiquitous when I went to Rutland, because if folks think this is something that affects poor kids or elderly or people in the Brattleboro area,
Right.
or no, it's everywhere.
Everybody.
And a lot of times folks get addicted because they had surgery.
Right.
And and they get pills for pain, or they have chronic pain and they get addicted. And it's not it's not what you think it is. And it's something, as I said, that affects our entire society, all of
Yeah,
our
right.
communities. So
Yeah. just
it's really
filters out.
important to deal with.
Yeah.
It's amazing because I can totally see. I had a skiing accident that herniated 2 discs in my back, and I never had to take, really hardcore painkillers for it,
Yeah.
fortunately. But I can totally see how someone who
Sure.
has that kind of pain can fall into. You'll do anything to stop it.
Oh.
And there's no joke. Like, you have something that's that debilitating. It's like you're gonna do what you have to do to stop it, and you can very easily get sucked into that cycle.
Yeah, it's there's a statistic that 4 out of 5 people that become addicted to opioids did it from prescription pills.
Yeah.
They're starting to crack down on that, though, aren't they? Because you have to go, I have a chronic illness, and in order to get my pills, I have to every month go and the doctor has to fill out a new prescription, a
Yes.
hard copy prescription, so that I can't use anything more than my 30-day supply.
Right.
And then I have to sign my life away at the drugstore.
Yeah, there's a whole bunch of things that have
Yeah.
happened in Vermont to look at prescription monitoring, to look at
Right.
the amount of prescribing, to educate doctors on, exactly
Yeah.
what's happening.
Because years ago, what do you want?
Well,
That's what it was. I don't think, they didn't
Yeah.
mean anything. It was just, here, what do you want?
Well,
Help you out?
I mean, anyone who's listening, if you want to read a great book on this subject, it's called Dreamland, and
Oh, really?
I would highly recommend it. And this crisis really came about because of 2 things. One, because pain became the 5th vital sign. What pain level
1
are
to
you
10.
at? Yeah, what pain level are you
Right.
at? And it became something that doctors were sort of rated on,
Right.
on how well they were managing it. And also at that same time, we created, us humans, we created this thing called Oxy, and it was easy to prescribe, and it helped with the 5th vital sign. And there was literature at the time saying that they weren't addictive. And you look back on that, and we know that that's
Wrong.
not true anymore.
Right.
Or it was never true. And so there's the beginning of the problem, and here we are.
Yeah.
But but the problem we have now is that once you're an addict, it's treatable, but it doesn't just go away. It's something that requires treatment over time.
Right. Well,
And
it's like a withdrawal thing, right? I mean,
well,
over time.
if you stop taking opioids, you have withdrawal, but
Right.
but a lot of folks go into our hub and spoke program where they're on medically assisted treatment,
Right.
where they get methadone or Suboxone, but also with the mental health or social worker wraparound services
component.
to try to help you with
Yep.
with what is something that may have affected a lot more of your life.
Right. I was
and-
on the community group, because I was on our select board in Berlin. We have a methadone clinic there, and there are so many people. Oh my,
Well, I mean,
it's unbelievable.
if you go, and you got to go early in the morning, because
Right.
most of the folks that are coming go to work.
They're going to work, exactly.
So it's
So they really want to get better, and they want to work and
right.
be productive members of society.
That's right.
But- So I'm sort of glad that's there. There was about 10 of us who were on this committee because there was a little bit of pushback in town, but it's worked well
Yeah.
for them. So, all right, so moving on, this one I can relate to, Department of Aging and Independent Living. But I didn't find, what are the crises and issues that you're dealing with? I was thinking of education, training, and employment, which is a big issue for the disabled.
Yeah.
There's no real crisis in that department, is there?
Well, I
was
don't want to
looking.
say there's a crisis.
Not a
but,
crisis, a
I mean,
challenge.
no,
How about
because,
challenge
no,
and
because
opportunity?
we use the word crisis so much that I
Right.
worry that it becomes something that people don't hear.
Good point.
But I think that we're all aging. I mean, we have a population that what are
Right.
we, number 2
I
oldest?
thought we were 4, but close enough.
Okay,
We're
well
probably,
maybe I'm
we're
premature in my
2.
I
number
think
That's
we
two.
are
impressive.
number 2. I think.
Are we really?
Well,
When did that change?
Yeah, we're right behind Maine, and we're catching up, I believe.
great.
Yeah. So second oldest state, and nursing homes, are something that are a challenge.
Yep.
How do we fund them? How do we make sure there's quality?
Right.
Should people be in them? Meaning we have a tremendous program called Choices for Care that allows people to
People
stay
stay home, right.
How do we run that program so we
Yep.
meet the needs of seniors? Dale has a huge job, and that the Choices for Care, nursing home, how we do all that, that'll be a big deal over the next 5 years.
Really. How about
Yeah.
the disabled here? Because I'm pretty good friends with Sterling Peebles. I don't know if you know Sterling. And she's been on the show once or twice, and she's always promoting employment for the disabled. But
Yeah.
there is a resistance from employers to find that right match, because what a great thing for the disabled to be contributing, make money,
Yeah.
and feel good about themselves.
Yeah, so Dale does a lot of work in that area.
Do they?
The hardest thing is when somebody is disabled and does want to participate in the workplace, making sure that the entire benefits package that they have supports their desire to work. Because we
Right.
want them to work. We
Right.
want them to do
Sure.
whatever they want to do. And so, but what can happen is they can lose their benefits if they get too much
Oh, yes,
income.
right,
And
right.
and so Dale has a big role in sort of keeping track of some of this stuff. DCF also has part of this as
Right.
well, but it's
So the
it-
proverbial cliff, sort of.
but this is a different one, but
So
it's
you
sort of
make
the
too
same
much
thing.
money and you
Right,
lose out.
you lose your benefits.
Right.
So, but explaining to people different programs and options and all that, that's important stuff.
Yeah.
And that's what,
That's great.
yeah,
Good. We love Sterling. Do you know Sterling?
I believe
Oh,
I've
you will have to. She has worked so hard. She has this thing on called the Employment Corner, and she's always out talking about getting people interested in working, and the disabled folks she knows. It's great. So I don't know who our Commissioner of Health is. I knew Harry Chen, and I sort of lost.
So Harry Chen stayed on.
Oh, he did.
When I first came in as
Yep.
secretary. He stayed on because Dr. Mark Levine was basically had accepted the position.
Yeah.
But with doctors who have a practice, he had
Right,
to
they had to-
work
yeah,
his way
right,
out.
right.
So Dr. Chen stayed on for a couple months, and then Dr. Levine came in. And Dr. Chen did a phenomenal
I
job for
love
the state.
Harry. Oh, he's great.
And Dr. Levine has picked right up where Dr. Chen left off.
Do you know what their major focus is these days? I don't know whether autism is part of that issue. Because we've done some things with the Central Vermont Washington County Mental Health Group here, and their autism and their schmoozling room, and I just find it amazing that autism numbers keep going up.
That could be a whole show.
Yeah,
We could
no,
get-
exactly,
So one of the biggest parts of the Department of Health is ADAP, which is basically,
Right, of
which
course.
houses,
Alcohol.
alcohol and
Right.
drug programs. And
Right.
so one of the biggest focuses of Dr. Levine is this opioid crisis.
Oh, see, it's
so,
everywhere, right?
Yeah, so, that's a big challenge. But also, the health department runs a lab that tests, whenever you hear of a foodborne illness outbreak
Right.
where there's being
It's them.
someone's testing something, that's happening in Colchester with Dr. Levine's folks. They test if there's an animal that has rabies, or there's
Right.
lead in drinking water, or,
Right. Or those ticks.
I was
I'm
gonna
working
say,
on-
there's a
working
rise
on
in
my
tick-borne
fourth one
illnesses.
this
Yeah.
year.
they are the tick people.
Yes.
Yeah, so they have a lab, they have ADAP, they have a huge what I refer to as population health or public health mission of education, of telling people what's going on.
Right.
Like right about now they're going to start up with the flu.
Yeah.
They've been on the tick issue. Yeah. So his plate is way more than full
Yeah.
dealing with
That's
all
great.
this stuff.
That's great. Well, I just knew Harry from the legislature as well, because he was
Yeah.
in the legislature beforehand. But anyway, just two more actually, and then Ben can go on to some other issues. But the Department of Mental Health, I'm very close to the folks here in Washington County, and it just seems to have blossomed, mental health issues. Speaking of being everywhere and impacting everything,
Yeah.
it's really bad.
So you're right, and Commissioner Bailey, Melissa Bailey,
Right.
when you're not going to find a harder working person or a smarter working person, but she has her work cut out for her. So this idea that folks are having issues and then go to the emergency room and need treatment in a inpatient psych bed,
Right.
and can't leave to counseling, can't leave to
Right.
some other thing like home health, or can't get a bed, is real. And
Yeah.
we've been working on it basically since the day we started to try to figure out exactly what is happening upstream, like what's causing this, you
Right,
know?
right.
Like, and
We getting better at diagnosing. Like when I was growing up a long time ago, there was maybe 2 categories of autism or 3, and now there's a spectrum. And I don't know
Yeah.
whether we're getting better at identifying different levels of mental illness, or
Yeah.
we're really all stressed.
So what I would say is that this is complicated, and this should be a whole show, but back in the 90s when we deinstitutionalized mental health in this country, not just Vermont, we said Plan A is not working. This isn't humane. They should be in their community. And so we said, we had 500 people, in Waterbury at the time in the facility.
Right.
And we said let's create different standards, allow people to go back in their community. Great idea. Totally support that. Plan B was we're supposed to build the community assets to care for the folks when they return to their community. And I don't think we've achieved that. And
Yeah.
so what you're seeing is Plan A, we don't like it, let's stop that. Plan B, have we done it to the extent we need to yet? Well, what's interesting is if you go to Boston or you go to New Hampshire or you go to Rhode Island and you read the paper, it's the same story.
Yeah, they're
And-
all dealing with it.
Right.
Every state's dealing
Right.
with it.
So we've got to figure out Plan B or Plan C or Plan D, whatever you want to call it, to figure this out because it's not working.
Because we don't even have here in Berlin, we have the new mental health facility.
Yeah.
And they don't have enough I think it's nurses. They've been in a little bit of trouble with the feds because they don't have enough qualified nurses to go into the field.
Yeah. So we run that.
Yep.
AHS
Right.
runs the Vermont Psychiatric Care Hospital, 25-bed facility,
Right.
and great people work there.
Yes,
And they
I
work.
can't even.
They
God
work
bless them.
so hard.
Yeah.
But it is hard right now to hire nurses.
Yeah.
And it is hard for Central Vermont. It is hard for other institutions in Vermont to hire nurses, especially in this area. And so we've reached out to get traveling nurses and things like that.
Is there a competition of salary for these people? Because Mary Moulton, when she was on there, she
Yeah.
was saying they have qualified people, but they can't keep them very long because then they go to the hospital and kind of, as you would, you need to make money.
It
while
sounds
you're-
like a lot of the designated agencies aren't able to
Pay them,
recruit
yeah, right.
effectively or even hold on to the employees that they have because
Yeah,
of
'cause
this
there's this wage
rotation.
war going on.
And the problem is that people are just in their world trying to figure out how to solve their problem, and they're like, hey, if I pay $2 more an hour,
Right.
I might be able to hire somebody.
Right.
They're not worrying about,
Sure.
they're just doing their thing, and
Trying to
it's
get through the day.
yeah, we just don't have enough,
Yeah.
and so that's a tough.
Well, that's why I was afraid. Patrick Flood came to our elementary school, and we had a big discussion about it, where they wanted to put, as you said, in communities, like 4 or 5 around the state. But I thought we were having trouble getting doctors and nurses for one building. When it was in Waterbury, they still had a little problem. So how can we possibly find enough and pay them enough to staff 4 or 5? And I truly appreciate being in the community, because I think it's very sad that they can't be visited by.
Yeah.
I get that part, but I
Right.
don't know where you find the most important thing is to get them the help they need. But I don't know how you're going to do it. I really don't.
Yeah. So there's a lot of problems in what you just described
Yeah.
that we've got to tackle, and the workforce issue. As we age, we're going to run into it with dentists. We're going to run
Sure.
into it with docs. We're running into it with nurses,
Yeah.
and so we've got to get really innovative and really creative to try to figure out, how can we. Not how can we steal from each other,
Right,
but
no,
how
to
can
help
we?
each other.
Yeah, how can
Yeah,
we help everybody?
right.
And that's not easy stuff.
Because the age thing, I remember when I was in personnel, we got visited a lot by staff with injuries, back injuries, and they just don't have the physical strength to help move patients around and stuff, or if there is an altercation.
And it may be expensive to fund, I think, some of these community mental health hospitals, like the Central Vermont one. But it's a lot cheaper than sticking someone in an emergency room bed, which is
for
what
sure.
happens a lot of the time,
Yeah,
is they get stuck in an
absolutely.
emergency room
And
bed.
there's little beds there. They have to wait for beds, and they stick them in
Right.
Right.
really strange places.
Right, but I want to be clear that Plan A didn't work. You know, putting 500 people in a building,
Right, no.
that didn't work.
Right.
And so when you say, we want to do this in the community, well, we have the designated agency sort of design, and the question is, you know, how can we improve upon it
that's
to make
different
it so that it actually works in the community? And the designated agencies have a lot to say in this area. You know?
Right.
So legislature put in, and the governor signed the budget bill that put, you know, $8.1 million into Dale and into mental health
Yeah.
to help the designated agencies and others that give this kind of care. So, you know, that will help. I'm not saying it's going to
What
cure
kind
it.
of timeline are you looking at from a planning perspective to get this sort of
So,
better?
Well, so
structure?
the money that was put in goes in now. The idea of what do we do with facilities and what do we do with flow and what do we do with the emergency rooms, we're trying to work on a proposal for this coming legislative session. And so we've literally had, you know, a whole bunch of meetings with anyone that wants to come and talk about why are folks presenting in the emergency room.
Right.
And we had Dr. Desjardins, who works for University of Vermont Medical Center, do a study of UVMMC and Central Vermont to say, why are people not being discharged? What's the barrier to discharge?
right.
And it's fascinating. And I mean, it's a public document if anyone wants to see a copy of it. But, you know, it's not what you think, meaning it's not just that they maybe don't have a home to go home to. Sometimes it's that they don't have the ability to get supportive nursing at home that they might need, or counseling at home,
Right.
and other things. And we've got to figure that out.
We had Tony Fakos here, and I forget the name of their
Team 2.
Team 2
Yeah.
program. I don't know if you're familiar with that now. They
don't know if I
work
am.
with your people and with mental health people to know how policemen should deal with crises as it's happening in the field. And your people come on board, and they work as a team, and it's really apparently very successful. I just wrote to Tony to ask him if they did get funded in this bill, in the budget, but it seemed like to make so much common sense, because
Yeah.
the law enforcement is being trained and working with mental health people, your folks,
Yeah.
to make it work out. Because we've read some pretty not so great things about the interaction between somebody with mental health and the police. And,
Sure.
and
Well, to be fair, we didn't create the police department to be
No.
social workers or
Right,
mental health
exactly.
workers. That's the
Right.
job of those
Right.
folks.
Right.
And I had a great meeting up in Chittenden County with every town manager from
Oh,
Chittenden
nice.
County, every police chief, and some of the fire chiefs. And their point to me was that we designed this street outreach, which is basically what you're talking
Yep.
about, is putting
Right.
mental health and social workers
That's
together
what
with
this
police.
is, right.
Street outreach program. And their point to me was, you know, how do we just double the size of it?
Right.
You know, and because we think that's, you know, they had a lot of analysis on why that's the right number. And so, you know, that's, if you can get to people prior to the, you know, to the crisis, before they're just so sick,
Right.
you know, that's everyone's goal. Once they're in the emergency room in a crisis, there's a whole bunch of things that could have happened upstream that
Right.
it could have
Right.
hopefully
Minimize
prevented
it.
that. So that's the
Yeah.
goal
Yeah.
of
Yeah, so
what we're
it
trying
was
to
a
work
great
on.
discussion, the Team 2.
Well, I mean, we could spend the whole show just talking about either one of those issues. I mean, we've talked about the opiate crisis and mental health crisis. And there's a number of other interesting things that that your agency is working on: emergency management, education, working with education and child care and the interplay
Right.
between those. Housing, and one of the more interesting ones perhaps is the benefits cliff, which Governor Scott has promised to have a plan in place within 100 days. There's a whole bunch of stuff in there to kind of unpack.
Yeah, big stuff.
Big stuff.
Yeah, big stuff.
And you've
So,
commented a lot on these in articles and been quoted on, because I was doing research on Digger, and you've really weighed in on all these because it impacts your
well,
whole
and-
agency.
Well, and also, you know, we talked about values earlier, and you and I have talked about this before. You know, I want to be transparent about what we're doing. So when I'm asked, I tell people what we're
Right.
up to. So you just asked about a whole bunch of things. Let's talk about pre-K for a second.
Yeah.
Okay. So we were charged by the legislature. When I say we, I mean Secretary Holcomb, and I were charged to go take the summer and rethink Act 166, which is our universal pre-K funding law, and try to figure out, how we deliver pre-K, how we pay for pre-K, how we have quality pre-K in a mixed system where some of it is delivered in schools and some of it is delivered in private settings, and how does all that work? And so we've already started meeting on it, and it's another one of those big issues of what is more important than getting a child on the right path.
Right.
Yeah.
And so that's why that's so important.
And it's critical to early learning, and it's an interesting intersection, I think, because, and evidenced by the fact that you're working with the Agency of Education on this.
Right.
But it's an interesting intersect between education, human services, and also economic development, because this is not just about the kids. It's about the kids long term, but it's also about the parents, and
Sure, so they can go to work.
and then so that they're able to work, and that's from my understanding, I started bringing the business community in to be part of the discussion. It's a really interesting issue, and it's very critical, I think, moving forward.
Yeah, and I think that all of the research and studies show that what happens in those early years is not just an indicator of your future, but almost your future.
Right.
So there's this great film, Resilience, that's out there, and I would recommend everyone see it. And it talks about adverse childhood experiences and what goes wrong when you're a kid. Doesn't stay with you just as a kid. It actually changes you. There's research that suggests it actually changes your DNA. And so that by the time you're 40, you might have all sorts of chronic health conditions because of what happened to you when you were 4.
Right.
And so to the extent that you can have quality childcare, quality interactions in a learning setting, not learning like calculus, but learning at 4 years old, is a tremendous value to you in your later life. And so Governor Scott has been a pretty clear supporter of that. But this is tough work because it's not just like K through 12 where you have a school system that you lean on. Great people in K through 12 education. You say to them, teach Spanish or do something. You can lean on them to do it. But this is a system where you have folks with just a few kids at their house, or other centers with a bunch of kids, or they might be doing it at a school system. And how does this whole mixed use thing work? And what's the money
Right.
flow? And it's complicated.
Well, in those early years too, for a child, are really critical. Just you think about the amount of learning that a child does between 0 and 5
Right.
years old. They gain so much knowledge about our culture and how the world works in that years, and that's regardless of book learning when they learn later on. But there's so much packed into learning
They're like
to communicate.
sponges, right? I
Well,
mean,
yeah,
at that
so-
age, they just sop it up.
So what's interesting is I like to talk about it as like wiring.
Right.
So the idea that we have all the wiring when we're born, and then it's just a matter of growing up big enough to learn, is not the way it works.
Right.
The wiring actually gets built when you're a baby
Yeah.
through interactions that you have, and it's either built right or it's not built right.
Well, and because of the amount of growth in those first few years is so rapid that it really lays the foundation for everything else.
That's right.
And I was one of the only Republicans who actually voted for pre-K. I got yelled at. But I was so adamant about this. It's just the right thing to do. And it also helps usually the woman get a jump on her career. It's 5 years, because then she's going into business world much later on, and she's at a disadvantage.
That's right.
It really works. I was
Yeah.
for it.
Yeah, it's critical, and it's the right thing to do.
Yeah, it is.
Absolutely.
Totally.
So just to housing is another thing that you
Right.
guys are working on that's been described as a crisis. I don't know if you'll describe it as a crisis, but
An
other people have
opportunity.
an opportunity.
Yeah. Well, no. So, if you are a family and you become homeless, that's a crisis for you.
Right.
And there's no doubt. And so we have a whole bunch of programs where we try to, as a state, put money into affordable housing and shelters and emergency housing and other things like that. And the question is, does it all work together well enough to get to the point where we eliminate family homelessness? You know, eliminating family homelessness has been an AHS goal for a few years. It's a pretty big goal. I mean, it's a stretch goal.
It's a difficult, yeah.
But the point is that, you know, you know, you think about a family in crisis. There's no, you know, that is not something that that we should think is beyond our reach.
Right.
Because it doesn't just impact, which is tragic, the homeless. We've had a show where people can't hire somebody from out of state to come in because there's no affordable housing
Right.
for that couple who's kind of middle of the road salary.
Right.
There's no place for them to live. So it's impacting
It
a
impacts
lot of-
everyone,
yeah,
just
a lot
about
of folks.
everyone.
Right.
Yeah.
So we've got, I think, 2 minutes left. I don't know, Al, if you have something we haven't touched on that you'd like to talk about, or
We haven't talked much about corrections.
let's talk about corrections.
Yeah.
I just said that's the one job I
Yeah,
haven't had I'd like to
Yeah,
have.
so,
If anybody wants me to take a job.
yeah, I mean, you know, corrections is a department led by Lisa Menard, and in most states, it's not part of AHS.
Right.
You know, so we have it. We have an integrated corrections department where probation and parole and the facilities are all under one commissioner,
Right.
and then that's all in our human services agency. And so it's a really interesting format. But I think it really allows for conversations and good work to be done, because our mental health crisis, use the word, doesn't stop at the door of our correctional facilities. I mean,
Right.
a lot of folks are there because of either behavioral health or mental health issues.
Yeah.
You know, so opioids, same thing.
Oh,
You know,
I can't even imagine.
our corrections team has put together. We're one of like 1% of correctional departments that does medically assisted treatment for opioid use in
Yeah,
prison.
yeah.
You know, so we're, you know, and there's talk of how we can expand it or change it or do it better. But you know, it's just a lot of good work been done there. And I think that, you know, the question that I get asked all the time is about the out of state. You know,
Oh, sure, why,
Right.
a lot of money. And
right, and you know, what's the best way to do that? And you know, the question that's going to be before Vermonters is,
Build a
you know, would we rather have 260 folks out of state, or would we rather build something
Yeah.
modern?
Well, you know, we were
and
just talking about housing. I just remember, a lot of people have to stay in prison beyond, I think this really presses a button for me, beyond their term, because there's no place for them to go. So because of the lack of housing, they are spending more time than they were charged by the judge. I just think that's bad. Sorry.
No, well, no, I think that you bring up a great point.
Yeah.
You know, we have folks that are basically on detainer
Yeah.
that haven't been found guilty of anything, so to speak, and they're, you know, out of 1,700 males in our correctional facility, a little over 1,700, 400 plus are on detainer.
What is the detainer? What
Detainer
that?
is when you don't get bail.
Oh,
you're-
okay,
yeah,
so you're waiting.
Right, so you're just
Oh,
waiting.
I
And
never
so,
heard that word.
And then another, you know, X amount of folks are waiting for
Yeah.
things that would allow them to get out of prison, and that's, you know, that's a tough.
That's another
That's a
show. We've
tough
got
issue.
about 5 from
Yeah.
your visit. So I'm sure, I think we've sort of run out of time, and I really apologize, Al. We could be talking here all night. Thank you all for tuning in. Just remember, we'll see you next week, and keep listening beyond the sound bites. Thank you all very much. Appreciate it.
Thank you very much.